One of the other challenges that I have is trying to convert patients in the emergency room. And of course, when they come to us, they're usually seeking pain medication and going to give us some kind of story. And the nurses know right away. I had a patient who had a history of kidney stones and multiple other pain issues. And when we looked up on the prescription monitoring program, I could see that she'd picked up opiates from many different providers. And her story to me didn't quite fit the picture. So I was prepared to just have a sit down and talk to her about what the real issue was. And as I presented her with the list of all the places where she picked up opiates, she became, as would be expected, very mad. And she said, "You're accusing me of being a drug addict, and I don't know what you're saying, and I'm going to call your administrator, and you're a bad person." And I said, she told me, "You don't understand. I have pain." At which time I pulled out a card from my clinic, and I said, "I am actually the one person who does understand." And we sat and talked about what the real issue has been, and she told me her history. And as I said, "I can help her with this scenario," she started to cry. And that was for the first time she said she'd ever had anyone sit down and talk to her and listen to her story. And most people don't understand that these people had something else going on in their lives that led them to this point. And typically it's some kind of traumatic event or some kind of painful event or something that triggered them and then caught them in this spiral of addiction, which they just need a break. And to give them a break, and to make that connection is very meaningful.